If you were looking at this sheerly from a financial perspective and eliminating all thought of the human right to health, you could simply say it's not a good investment to spend money on delivering antiretroviral therapy to people and just ignoring their liver disease. People who are co-infected, especially with hepatitis C, sometimes have a more difficult time tolerating their antiretroviral therapy, poorer quality of life, and they're vulnerable to a range of systemic health problems, some of which overlap with problems associated with HIV. So just from an investment perspective, it makes perfect sense to make treatment available to all HIV-positive people who are co-infected with hepatitis C. One of the things that people don't think about, I think the high cost of direct-acting antivirals has overshadowed this, but in places where HIV treatment is based on the WHO recommended antiretroviral regimens, it really limits some of your options for DAA-based treatment, and that we're going to have to really consider how to scale up and make antiretrovirals that can be used with hepatitis C treatment available. This is challenging financially. It makes procurement challenging. It makes several things challenging, including talking to someone who really trusts their HIV regimen, has been doing very well on it for a long time, and saying, you're going to need to switch to something else if you want your hepatitis C cured. And I think that's a sort of hidden expense and complication. It's not insurmountable, but it's important to consider. I actually feel quite hopeful with the advent of all the generic DAAs that are coming out. I think it will create the opportunity to treat co-infected people, and there already is a healthcare system that can deliver treatment to people living with HIV. I think the big challenge is how we're going to leverage that for the much bigger epidemic also of people who don't have HIV. Because if we try to stop co-infection in one population and leave another entire large group with viral hepatitis, viruses don't really recognize barriers like, you know, this person has HIV and they have access to treatment, this one doesn't. It also challenges us because there are really several different hepatitis C epidemics. There's the one among people who inject drugs, and that can be quite challenging to successfully deliver antiretroviral care and treatment, let alone HIV treatment, harm reduction, et cetera. There is the one among people who are exposed through unsafe medical injections, and there's the epidemic among HIV-positive men who have sex with men. We're going to need different messages and different approaches to reach all of them. But the other really important thing to think about is this is a cure. I know people who endured really harsh side effects from interferon and said, this is nothing because I can be cured. I've been living with HIV for 2 decades, and there's no cure for that right now, and I'm willing to do whatever I can to be cured of something. So as complicated as it might be, the idea for both patients and their medical providers, how exciting to be able to cure people. It's a wonderful thing. So I think we need to hold on to the level of optimism about what these drugs can bring to people, as well as working to continue to make them more affordable.